Good evening, Tracy. I'm your host, Raj Singh, and I have Gurdwara along with me. And we are having a guest today with us from a curative company. They are performing the COVID-19 testing throughout our county in San Joaquin, from in Tracy and covering Mountain House, in Lathrop, and Stockton, covering those areas, and Lodi as well, and Manteca and Ripon, all those in conjunction together. So today, why we are here is to learn, and if you have any questions, to learn about who is curative, how did they come into the entity, and what kind of testing they're providing, and where are the locations of all those, and how can you book an appointment, and what kind of testing it is. Is it compliant testing with travel guidelines, or how long does it take for you to get your test back? Is there any cost associated with it? Or do you require insurance for it? Do you require immigration status for it? All those questions we will be covering in our today's podcast. So now I would like to hand over to Shoshana, who is joining us from the curative. She's the Northern California partnership manager that she's representing curative, and she will talk to us about overall process today. Thank you, and welcome, Shoshana, being with us today.
Thank you. Thank you so much for having me. I'm excited to be here. It's been wonderful partnering with you all so far and to bring more accessible free testing to the Central Valley. So thank you for having me.
Thank you very much, Shoshana. So we have all learned about curative. We have heard this name. This is a very big name nationally in COVID testing. So will you please share us what the company is and how did it come to light, and how it's helping the testing throughout the United States?
Sure. So Curative actually was founded last January, in January 2020, originally to test for sepsis. And then, as you know, the global pandemic of COVID-19 came to be. And so Curative went from being a very small lab whose original intention was to test for sepsis to developing a self-administered oral RT-PCR swab for COVID-19, and we quickly became one of the largest COVID-19 testing providers in the country, in the United States. So we're originally known as a testing provider. It's kind of Curative's bread and butter, if you will, and now we also have worked on mobile flu clinics, antibody tests, and now are working throughout the country to partner with counties on vaccine distribution, which is really exciting. We have over 10,000 testing sites in the United States. We have 3 of our own labs, one in Los Angeles, one in Texas, and one in Washington, D.C. And Curative has performed over 16 million COVID-19 tests to date. And Curative's mission is really to provide accessible public health services to meet people where they're at. So really the beauty of Curative is that through our mobile van program is that we can bring services like flu clinics and vaccines and testing to people in their own communities.
Thank you, Shoshana, for telling us about how Curative came into the existence and how many testing sites are out there and how many tests you guys already have done. And Gurdwara, if you don't mind, can we move on to our next chapter to look at what kind of technology you guys are using and how these labs are processing overall these tests, or the setup of different sites or the vaccination. I believe we have a couple pictures on this slide. Can you tell us a little bit more about what's going on in here?
Sure. So there are a few pictures. One, as you can see in the bottom right-hand corner, is actually a photo of one of our scientists in the lab processing the test. One thing that makes Curative really unique is that we have our own labs. So all Curative tests are then shipped to one of the 3 tests, depending on the location, and then we process them immediately. We promise test results within 24 to 48 hours of arrival at the lab. Usually right now it's actually closer to 24 hours. Our lab runs 365 days a year, 24/7. So we always have people very, very hard at work. We have an amazing team at all 3 labs. so that people can get their test results as quickly as possible. The drive-through picture that you see is a drive-through test clinic. So we have a few different models: a kiosk, a mobile van, a drive-through, and then we do drop ship tests as well. So we can test county employees at their county office, for example. And then we also use our own software scheduler, which is really easy to use, and people can either make appointments at home ahead of time, or they can walk up, and we do walk-up appointments for patients as well, which works really well, especially if you don't have technology at home or if internet access is limited.
No, thank you, Shoshana. I think that's one of the very important factor that we got a few calls before we were launching this, that do I need to have an iPhone or some sort of a device in order to make an appointment, or can they have me as a walk-in available? So I'm glad you were mentioning that. So it's not mandatory that you need to have an appointment. It's more encouraged if you can, but you guys will be taking anybody who walks up to your testing site, and they will be able to accommodate that person.
Absolutely. Yeah, it's really important that, people for a variety of reasons aren't able to make an appointment online. And so it's really important for Curative that we provide testing services to people when they show up to take a COVID-19 test. We do ask for people for walk-up appointments that they come at the earlier side of the shift if possible. So if the testing window is from 10 a.m. to 4 p.m., not to arrive at the last minute, but to give the testing team and the crew time to actually give you the great service that they can. And then we also ask that you bring, if you have an ID and insurance information. One thing to note is that we do not ask any questions about immigration, and we don't report any questions about immigration. And there is no bill ever also to a patient receiving a curative test. So no one who ever comes to receive a test with Curative will ever receive a bill. There's no copay either. All of our tests, when you go through, you're asked to answer some questions about exposure to COVID-19 and if you have any symptoms. And based on those, how you answer those questions, you're deemed medically eligible for a test, which means that your insurance, if you have insurance, will pay for the cost of your test. And if not, the Federal CARES Act will pay for the cost of your test.
Okay. And Shoshana, on the insurance side, just a quick question to understand. So if somebody has the insurance and they provide you that information, do they need to file some sort of a claim with their insurance company, or that's it just basically a sort of a customer coming into your testing site and they're getting their product and they're getting out of there, and rest is getting done between the Curative and the person's insurance company?
Exactly. So Curative works directly with the insurance company, whether that's Kaiser, Aetna, Blue Cross, or even Medi-Cal or Medicare, and we bill directly to the insurance company, so you don't have to worry about that at all.
Okay. Thank you so much. And Gurdwara, I know you have a few questions. Please go ahead.
Yeah, so Shoshana, there's a question always being asked. So if somebody gets tested on Friday, will they be getting results after 48 hours, or Saturday and Sunday, those are not included while getting the test results?
Yeah, that's a good question. So our lab does run every day of the week, 24/7. So even if you get tested on a Friday, we overnight ship that test to the lab, and so you will get your results the same amount of time as if you had gotten tested on a Monday. So likely on Saturday, and if not by Sunday.
So while if somebody is making an appointment or you guys make it, so does they have to provide an email ID as well, or just a cell phone number will be sufficient to get the test results?
You do not need an email address. If you do not have an email address, you can always use a friend's or family member's, or you can just leave that blank. A cell phone number or a home phone is really helpful, so that we can text you the results of your test. And if you don't have an email or a cell phone number, you can also go online afterwards, and you can go to curative.com and search by your appointment number, or you can call Curative support line and get your test results that way.
So on the website, Shoshana, is it possible for the customers to track it as well? So how much time left, or where their test result is? Because sometimes they get curious, so at the last minute. So is there any such option?
Yeah. So if you go to curative.com, at the very top, there is a button that says My Appointment, and you can use the code that you get after your test. You'll get a code. It starts with CUR, like curative, and then a bunch of numbers. I think it's 8 numbers or 9. And you can type that in, and then you can track where your test is, if it's made it to the lab, if it's in processing, etc.
And is there any contact number as well? Because some people don't like to kind of use or that much tech savvy. So is there any helpline number they can call and get the information as well?
Yes. So our email is support@curative.com, and our helpline number is 888-702-9042.
Thank you very much, Shoshana. Now we'll take it back to Raj.
All right, so I think we talked about very key points of all the questions that we were receiving from different individuals throughout our county. And now, Shoshana, can you tell us, when you talk about you guys are nationally covering the testing sites to keep the community safe. So talk about the national coverage. Can you tell us what are we looking at this map? Are these the locations that you guys are serving in?
Yeah, so this is pretty much a map of all of our testing sites throughout the United States. They change rapidly because the beauty of, especially of our mobile vans, is that we can pivot and we can go to new sites and meet the demand of the community. And also, I will say, so we test from California to Florida, in the Northeast as well, and outside of this map is also the state of Washington, and we have a really robust testing program there as well.
Thank you. Thank you very much.
Thank you very much, Shoshana. So one of the prominent questions that we have is it a FDA-approved testing? And if it is it RT-PCR test? So
yes.
Because some of the people who travel overseas, there is a requirement to get tested having an RT-PCR test rather than just a PCR test.
Yeah, so Curative is on FDA authorized, and we do have an RT-PCR test, so we're completely compliant, and we do have an EUA as well, an emergency use authorization, which pretty much all COVID-19 tests have because it's a pandemic. And one thing that makes our test really unique, as I mentioned briefly before, is that we actually we have an oral swab. So unlike some other tests where you put the swab in your nose, we swab you. It's a self-administered test. So you unwrap the test kit and you pick up the cotton swab, which kind of looks like a long Q-tip, and you swab the inside of your mouth for 20 seconds. It's self-administered, which means that you do the swabbing yourself, and you'll be under the watch of a trained healthcare professional who will be giving you specific instructions like counting for 20 seconds and telling you to swab the insides of your cheeks, all around your tongue and your gums, etc.
Thank you, Shoshana. That's very useful and helpful to understand. And I believe in order to kind of visualize it, the folks that haven't been to one of the testing sites, that how they are set up and how they look like, I believe this is what we are looking at. Can you speak about that?
Sure. So all of our testing assets look a little different depending on the community that we're testing in. Some of our larger sites are drive-through sites. So if you remember the very large testing drive-through in Los Angeles at Dodger Stadium, that was a Curative run site, so that was a drive-through site. And we also have a mobile van, which people in the Central Valley in California are used to seeing, and we have kiosks as well. And then we also have closed facilities, so we work a lot with schools and with county partners to ship tests to them as well. That's a little bit of a different model. That's not a public testing site, but the kiosks, drive-thrus, and mobile vans are public. They're all a little different. If you go to curative.com and you search for a test site, you can type in the city that you live to find the closest test, and then it will say if it's a mobile van, a kiosk, or a drive-thru.
Yeah. And I think especially as we are speaking from the San Joaquin County Central Valley side, we are having the mobile vans, which is on the very right-hand side on the last slide that we have seen that. So thank you, and Gurdwara, back to you.
Yeah, Shoshana, as in Central Valley, we are having these mobile vans from Monday to Sunday, so throughout the week from 10 a.m. to 4 p.m. So that information is on the curative website as well. So can you just speak about it? So where these vans are located throughout the week?
Sure. Yeah. So we're really lucky that in the Central Valley we have a testing option every day of the week, and so we test all the way up in Lodi down to Patterson, in Manteca, Tracy, Oakdale, Modesto. We just launched a partnership with Modesto Junior College, which is really exciting, and we love testing at the Sikh temples as well. So you can see every day different locations where our mobile van will be, and it can change in the future, but this is the schedule for right now.
Right. So thank you, Shoshana. I think this is pretty much every day. Anybody who's in the need to get tested, these are accessible and easily to locate them. And second, as we are getting vaccinated, it is at the same time we need to make sure the folks, they are not in the tier to get vaccinated. They are having these facilities available so they can keep them safe and their loved ones and their community. So thank you to Curative for this wonderful initiative, and thank you for your partnership that you're running the entire regions, Northern California's operations. It's a huge, very stressful task, and thank you for being very accommodating and always working with us. We appreciate you.
Thank you. And I will say to those watching, it is really important to get tested regularly, especially if you're out and about, if you're an essential worker, if you're going back to school. It's really, really important to keep getting tested until we are all vaccinated. And even when you're fully vaccinated, that doesn't mean that you can't contract COVID-19 and spread it. So it's important that even people who are fully vaccinated continue to get tested as well.
No, thank you very much, Shoshana. We sincerely appreciate all your efforts in Central Valley as well as across the United States to keep us all safe. To the audience, I would request if you have any follow-up questions that we may have missed, please send the questions to us. We will get them answered from the experts in Curative and get back to you. So with that, thank you all for watching. Thank you, Shoshana, and we'll be meeting in the next podcast next week. Thank you.
Thank you.